Is that a little bit better?
Yeah.
Can you hear in the back? Okay, good. All right. Well, thanks again so much. My name's Gavin McIntosh. I'm the vice president of the Care Group, and we own and operate the Gardens of Qualicum Beach. And we are very glad to have all of you here today. And we're also particularly glad to have two very important people over to my left. We have Dan Levitt, the seniors advocate for British Columbia. Thank you, Dan, very much for coming today. Yeah, we look forward to hearing a presentation from Dan just about the situation in British Columbia for seniors care. And so we're hoping after that conversation to also then get into a great conversation with Mary Polak. Mary Polak comes to us as the current president of CEO, pardon me, of BC Care Providers Association, an association that is dedicated to making the lives of seniors in British Columbia better, that the Care Group is a part of, and I sit on that board. So it's been a pleasure to work with Mary since she joined us recently. She's been getting up to speed very quickly on all the issues, but that's no surprise because Mary was a cabinet minister in many offices over the last 15 years, fair to say, yeah. And so we're very lucky to have her advocating for seniors in British Columbia as well. And yeah, thank you. And so with that, I think I'll get out of the way. And I just wanted to say, just sort of from a format perspective, we're hoping Dan will walk through his presentation for 20 minutes or so. Then we'll have a little bit of a conversation, sort of Mary and Dan and myself perhaps can chat. We have a couple of microphones. And then we want to leave some room for folks to ask questions as well, obviously. So towards the end, just to have if you have any thoughts around some questions, Sandra Davey, our general manager, who you might recognize is in the back, she might carry the mic around and make sure that you get a chance to ask a question. But the focus today is just about really understanding where we are at and where to from here. So with that, I'll leave it to Dan. Thank you so much.
Thank you, Gavin, for the introduction, and it's an honor to share the panel with Mary, and we're looking forward to the conversation today. It's great to be here, and thank you for your interest and your time today. So I'm going to speak for 20 minutes or so on the trends and the issues that we're seeing in British Columbia with seniors. I'm going to advance the slides somehow. Yep, there we go. Okay, return. Okay, so everyone knows about the demographics. Currently, where we're at in British Columbia is 1 in 5 people in British Columbia, 20% are over the age of 65, about 1.1 million of the 5.5 million British Columbians. There will be more seniors in the next decade, 400,000 more seniors. In the next 10 years, we're going to see 1 in 4, 25% of people will be over the age of 65. And when we think about the baby boomers currently, the oldest one is 79, and she'll be 90. Pardon? 103. So as a centenarian, you're saying a big deal with it being 80. I am 103. I love it. I love this. I would like you to come with me wherever I present, please. Okay, so this baby boom really is that bulge of a cohort of people that were born post World War II for about a decade. And so as they move through, we're going to see more pressure on our publicly funded and just the general infrastructure and programs and services for older adults. So there's more people who are living longer. When we look at those who are 85 plus, 12% currently are over the age of 85, and 17% will be over the age of 85 in 10 years. And here's why it's important, because when we look at where are they living, the majority of seniors live independently, 95%. It does change, goes down to 77% at age 85. And where are they living? They're living in places like this. We need more places like this. We need more assisted living, more long-term care, more independent living for people, because as you age, you become less independent. And we're going to need to make sure that we're recognizing that caregivers are the ones who are supporting those people. About 2/3 of those over 85 are either receiving care or providing care. The other third are having the times of their life. But the other 2/3 are the ones who might call our office or who might want to live in a place like this. 80% of seniors own their own home. So you may be equity rich, but cash poor. And some seniors defer their property taxes. Renters certainly have, low income renters have a different situation altogether, which I'll talk about in the next slide. 15% of seniors continue working because of affordability reasons or because they simply enjoy what they're doing. But not all older workers in BC actually get benefits when they turn 65. Something that I would call age discrimination that certainly, as we're looking at the public contracts coming up, with, for example, the nurses or the teachers, we're going to need to see more of them getting those benefits so they continue working because we're going to need more people in the workforce. 80% of seniors have a driver's license. And if you are over the age of 80 and continue driving, you will know that you to go see your doctor to prove you're fit to drive. And the doctors can charge whatever they want to you, up to about $300. And we like to see that cost being eliminated altogether so that you continue to be independent and not being reliant on public transportation, which 20% of seniors do. Dementia, 5% of people over 65 have dementia. Old age doesn't cause dementia, but you're more likely to get dementia as you age. And I want to make a differentiation between short-term memory loss and dementia. Dementia is pathology. It's something that happens to, unfortunately, to too many people, but it is not the normal part of aging. And short-term memory loss, that happens to many people. And it's not something to sweat and worry about because most of us have a technique of, so for example, you'll put your keys back in the same spot, Gavin, when you get, yeah. If you put your keys in the same spot, you'll find them. If you don't put your keys in that spot, you won't find them. That's short-term memory. So we shouldn't worry so much about that. We should worry about where we have pathology related to dementia. So here are some stats. One of the myths, the ageist myths about growing old is that you're all wealthy. Well, the truth of the matter is, why not? Wouldn't that be nice if that myth was, where you're not? I wish that myth was true. So 25% of all seniors in BC are living on $2,000 a month. Half of the seniors are living on $23,000 a year, $2,000 a month. $34,000 a year is half of seniors. The median point, that means $3,000 a month. If you're looking to rent an accommodation, you're probably going to be competing with somebody who's working, and they're going to be earning on average $60,000. So if you're thinking of that apartment that you want, who's going to get it? The $60,000 a year person or the $34,000 a year person? So when a senior becomes rent evicted, it's very serious and can be catastrophic. That's why we need more affordable housing. Last year, there were 13,000 people on the wait list for affordable housing. Only 6% got a space. That means 94% didn't, but 800 people altogether got a space. We need much more affordable housing. So whenever there is a project in front of council, we need that project approved. We need more seniors housing. We need more assisted living. We need more long-term care to be built. We also need to make sure that those seniors are getting subsidies. The low-income renters, how can they afford these things? Because there's a subsidy program called SAFER, which provides a rent subsidy for people under $40,000 of income. Unfortunately, the program's woefully inadequate. Not enough people are on the program, not enough people are aware of it, and the actual subsidy is too low for most renters. So the average renter is paying more than 30% of their income on rent, even with that subsidy. And our office is putting pressure on government to keep on improving it. They've not linked it to inflation, and people are falling further behind. Is aging in place a myth or reality? Well, here's one way of looking at it is if to stay at home, you need home support if you require care. Then there's more money being invested into home care, but there's less available for every 1,000 seniors over the age of 75. So what we've called for from our office is the elimination of the co-payment. Alberta and Ontario doesn't have a co-payment, and they've seen less people move into long-term care prematurely. So if you're living on $30,000 a year, which is about the 45th percentile of all seniors, you're going to spend your mandate responsible to pay a user fee. That user fee for 1 hour of home care for the whole year will amount to $9,000. So now you've lost a third of your income because you have a care need. And then you start looking at, I can't afford to stay home any longer because I'm only living on $2,000. What am I going to give up to pay the bills? So you might move into long-term care prematurely. We've been advocating a number of times in recommendations and in meetings with the ministers to get rid of this co-payment. It's one of the key things our office is pushing. So what could government do right now? They could ease the pressure off seniors who are living at home by providing more home care and improving the home care system and getting rid of that co-payment. They could also do things like have more adult day programs. So this is essentially long-term care during the day, and more respite care, which is overnight, short-term, long-term care. They could also build more assisted living subsidized, and that's properly funded. Some operators have gotten out of the business because it's just not subsidized in an appropriate way. And I believe that you should be linking the care and the service together under one operator. So here's a report we issued in July. At the end of July, we issued a report on long-term care. At 10 a.m., I was in the press theater like this in Victoria, in the Parliament building. And at 11 a.m., the Premier was in Kitimat doing a press conference on LNG. Well, the questions he was asked at that press conference about LNG were not about LNG, they were about LTC, about long-term care.
Oh.
And so he committed to actually responding to our report, which is good news about building more beds. We need way more beds than we have because, and here's the way it impacts on seniors. This is what Gavin was referring to, our situation in BC. 10 years ago, there were 3,200 people on the wait list for long-term care. Today, when we last looked, there were 7,200 people. That's an increase of 200%. So there's more people on the wait list and they're waiting longer. 10 years ago, you'd wait an average of 5 months for long-term care. Now you're waiting an average of 10 months. Now you might say, Dan, I know of somebody who waited a few days in hospital. Yes. And some people are waiting years at home. So that's the average though, is 10 months. These are people who are qualified for long-term care who really need more than 3 hours, 3.36 hours to be exact, of professional staffing care. And who's providing that care? Usually a spouse or a child. And that's really the situation we're in, is not enough beds and more people are going to be needing long-term care. Here's the actual gap. So when you look at this graph, and by the way, these numbers come from the Ministry of Health, specifically from Josie Osborne, our health minister. She's the MLA for Ucluelet and Tofino. And when you look at these numbers, you can see that on the far right, there's a huge gap. So this is showing the gap of what's needed for long-term care beds and what we have projected based on government's plans. So on the left side, you'll see there's a small gap there, about 2,000 beds. We have around 29,000 long-term care beds, but right now, currently, we need 32,000. When you go to 5 years out, it shows the number of beds the government's promised to build. And some of these beds haven't, the grounds haven't broken yet. So we're optimistic that they'll actually deliver on the promise. But the number of beds they said they will have in place is 32,500 in the next 5 years. By then, you can see the gap in number of beds is over 7,000 beds. That will be short. Fast forward another 5 years, a decade from now, the gap will be just under 17,000 beds. We need 50% beds in the next 10 years. Otherwise, who's going to end up? Where's it going to, the pressure will go? The pressure will go on caregivers. We asked caregivers when we did this report to verify the situation. We wanted to find out it's more than just numbers. We heard countless stories from 900 caregivers about the burnout, the hardest job they've ever done, and how close, if you will, they were to breaking point, beyond a breaking point. It affects their financial health, their mental health, and their physical health. So it's not a tenable situation. And I think part of our ethos as Canadians and British Columbians is that when you make a vow on your wedding day, you want to fulfill it. And that's really pushing people to the very brink. So why should people outside of this room, if you're talking about this meeting, and talk to others about why people should care about this, well, it affects everybody. If you go to the hospital, you'll see seniors in the emergency room, and some of those seniors could be in long-term care, but they're not because we've built enough beds. And if you go to emergency, you might be admitted. And I think, as Gavin was telling me about an experience recently with their own family member, you might be okay while you're getting emergency care, but once you go into the ward, you don't get quite the same amount of attention. And we start calling you, we have a special name for you at that point. We call you an alternate level of care. Basically, it's a holding pattern. You're waiting to be discharged back at home, or maybe to a place like this, or another site. So you're now using a bed that could be used for somebody who maybe is recovering from a knee or hip replacement. I tried to combine the word knee and hip into one word, knee and hip. And then if you live in long-term care, if you live in a place like this, you have a family doctor available. Well, you'll be going to your family doctor instead of having the doctor come see you. And then how do you get there if you've had your driver's license taken away? You're going to end up going by ambulance, using the ambulance for a reason it doesn't have to be used for. And then your caregiver, maybe your adult daughter or son who's caregiving for you, they're no longer working. So now they're absent from work at a time when Canada needs to be productive. And who will this impact also is the family caregiver, financially, mentally, and physically. And then ultimately, the seniors not getting the care they should be getting. I think that's really the story here, is that we're basically shifting the responsibility from government to the individual, to the families. So we made recommendations to government. I've highlighted most of these already. Building more long-term care, building more assisted living, building more subsidized housing and other options for seniors, encouraging more developments like this and others. We also want to see more respite care, more adult day programs, and we want to see a better transparency and approach to waitlist management. So while you're waiting, you have more communication. They agreed to that last recommendation. The other ones they're considering and planning, and we'll keep pressure on them to do that. We issued the report at the end of July. We wanted an answer back from them 2 months later, which happened to be October 1st, the International Day of Older Persons. So we got a letter back from the minister saying that she acknowledges the shortcomings and that she's actively working on this. Just a few thoughts about why aren't seniors more prioritized? And I would suggest that there's it's ageism. We did a report last March of this year. A year ago, we were asking seniors around the province to tell us their stories of ageism. And we heard from 9,400 people who responded. 84% said ageism is an issue. 54% said they've experienced it and told us their stories. It could be going into a store that caters to a younger demographic and being ignored, a clothing store, for example. It could be going to your doctor's office and your doctor says, oh, that ailment you have is just a sign of growing. So, I know Gavin's a runner like me, and I know that when runners get injured, and I went to my doctor and I said, Will, my knee is injured. Why did I get injured? I thought he would say maybe I need new runners or it's the way I run, but he said actually it's because you're getting. So I said, Will, if that's the case, my left knee's the same age. Why is it injured too? So how do we combat this? I think we went to do education to medical professionals so that you get tests no matter what your age is. My dad's 88 and just had a colonoscopy on Monday. And if you think about it, the reason why they're going to do a colonoscopy is to find out if you have polyps in your colon. If you have polyps in your colon, it takes 10 years for them to turn to cancer. Why give an 88-year-old a diagnostic test that won't have an impact for 10 years? Because you deserve to have that test. You shouldn't be denied medical care because of your age. So how do we combat this also is telling great stories. So Irene's on the left there. She lives in Sydney, in the south part of the island, and she plays hockey at 77. And then you have Bob here from Vancouver. He's on the resident council of the care home he lives in, giving a voice to those seniors who can't speak for themselves. And there's Jean from Kelowna. Jean makes toques. And I remember someone like Jean was at Children's Hospital when we had our women's hospital when we had our kids. I remember our kids getting toques when they were first born as infants. So seniors are contributing and volunteering, making the world better. And then you have Hillary, who continues to climb mountains. Just a final thought about reimagine aging. One of the things we can also do, I think, is for ourselves, is to embrace that next birthday. Embrace your own aging and be proud of who you are. And one thing I think you can do, I've been telling everyone I've been speaking to, is when somebody asks you your age, which is kind of rude, unless someone volunteers. If someone asks you your age, what you could do is give them the year you were born. Don't make it easy on them. Don't give them a 2-digit number. Give them the year you were born, because they're gonna have to do the math. They'll go 2025 minus say 1938, and they'll figure out you're 87. Okay, and then when they figure out your age, they're gonna tell you you look good for your age. You could say thank you, or you could say something like you could say, oh, you look good for your age too. Or you can be honest with them and say, you don't look good for your age. You could say, or maybe say, how do you expect someone of my age to look? Right? This lady in the front is saying, just say thank you. One lady in Burnaby suggested, I said to her, what would you say? And she gave me a 2-word response. The second word was you. I'll end with this thought, to be proud of who you are. Gloria Steinem is, I think, 91 now, and Gloria Steinem was asked at 40 about turning 40. She remember her name. This is a feminist leader. She was asked at 40 about turning that age, and the reporter shouldn't have asked her that question, because but he gave us a good line. Her response was kind of famous line. She said, "This is how 40 looks." So however old you are, you look perfect, and you've always looked that way. So thank you very much.
Oh, they're going to give me the microphone. That's always a risky proposition. But thank you all for coming here today. And we want to get to a place where we're having you ask some questions. But I thought I might warm things up by posing some questions to Dan that are based in part on what he's presented to you today. Because when you think about it, it's pretty provocative stuff, really. And I guess the first thing is, you mentioned that government hasn't seen fit to respond to all of your recommendations yet. Governments tend to do that kind of thing. I want to ask maybe a bigger question, which is, there's this huge gap. Conceivably, is there any way that government by itself can deliver on that many spaces?
So I would say the answer is no. And that's why I think we need families like the McIntosh family to be building places like this and operating them, and why we need more market. And if you think about where government doesn't provide a service, the market steps in. On the west side of Vancouver, where I grew up, I think Gavin as well, one company is Amica's building 1,000 units, right? And I know you're also building some units, because there just isn't enough that government can do to answer your question. So, and I think in some ways, I think it might be thinking, well, the market's gonna step in.
Yeah, it's one of those things where perception, when I get to travel around the province too, representing people who provide the care that isn't provided by government. And very often I run into people who think, well, government does all that. Government does all that. They don't. And one of the reasons that people will find themselves able to build a residence is because it is viable, right? They can afford to do it because the business case makes sense, right? Nobody's doing it because they're going to lose their shirt or because they're not going to be funded for it. So recently, Dan, as you know, we've seen, well, belt tightening in government, right? There have been a few announcements where they've been cutting some spending that used to support long-term care, assisted living, other places. They haven't replaced it with any kind of proper funding model yet. How do you think we can best be advocating to government for better support? I mean, right now it's pretty uncertain where that funding comes from, but for those who are in subsidized situations funded by government, they're not getting as many hours per day of care. And we're seeing some of those other funding pieces eroded. What are the kind of things we need to be saying to government?
Well, this problem, the way that government funds long-term care is based on averages, not actuals. So they'll fund everyone the same way, and then every site is slightly different. And what Mary's referring to is that there was, if you read the news or follow the news, you'll hear about in the news that the government's cut back on or just eliminated funding for overtime and for agency staffing. So many operators were relying on staff to work extra hours, and they didn't have enough staff, so they were hiring an outside company to come in and do the work. And this is kind of a legacy from the pandemic. And unfortunately, there's two things that should have happened that haven't happened. One is a provincial strategy for health and human resources for seniors care that doesn't exist, nor does there's a lot of work that was done by BC care providers and many members around with the government around a new funding formula. So we need a new funding formula for long-term care that actually recognizes the real expenses for each site. So the staffing levels that everyone deserves should be met. And just as an example of how far we're behind is that we provide in British Columbia 3.36 hours of direct care. That's what everyone's per day. Thank you, per day. Per resident, and this is mandated for all long-term care sites. If you live in Ontario, you'd be getting 4 hours of direct care, and the acuity level of the residents in those long-term care beds is the same here. So in BC, we've decided as a policy to provide, as my math, 0.7 less hours of direct care per person, but for the same people. And if you talk to the nurses union across Canada thinks it should be 4.5 hours of direct care. And that 4 hours that Ontario provides is the national standard that was developed during the pandemic. So all these national standards, I believe, should be adopted right across the country, and everyone in long-term care should be getting it. So what can you do is the question Mary asked me, which I'll get to now, is I really think that your voices are the most important. And I know that Kim's here, and others, your voice is the most important. If you think about it, your bias is really clear. Your bias is towards your loved one, and that's the voice that needs to be heard. And I think as baby boomers, if you're a baby boomer, you'll know that at the beginning of life, you change the way people are born, you change the way people die, and you've changed every part of the economy as you've gone through those different years. So I think the things that maybe your parents might have accepted growing older, you probably won't accept. And I think now's the time to voice your concerns.
So last question, and then we'll get to the more interesting questions, which are the ones that these folks are going to pose. Dan and I had the pleasure of attending a panel discussion. He was one of the panelists. I was lucky. I was just in the audience. But it was all about seniors care, but who's responsible for what part, right? What did the federal government do? What does the province do? What do the cities, the communities do? What role is there for local governments in trying to support seniors and support the construction of seniors' residences? How important is that, and what can they be doing?
Okay, I'm glad you asked the question. So Monday evening, I was honored to be able to speak at Richmond City Council, and they were replacing it wasn't new beds, it was replacement beds of Lions Manor in Steveston. And the council approved this plan on first reading, they call it. Everyone unanimously approved. The people who were opposed to it, which I call NIMBYism, not in my backyard, their concerns were really not that, they were legitimate concerns, but the need to build outweighed their concerns manyfold. So I think what the local municipalities can do, including Qualicum Beach, is they can, anytime someone has a project, to approve it. Sure, there might be some changes, modifications, but we need as many services and programs and buildings for seniors. We only have, as I mentioned earlier, we only have a decade to build this. We've got to build as much as possible. We have to build market, privately owned and privately funded, and also publicly subsidized. We have to have cities, and what cities, I believe what every city should do is every city in the province should have a seniors plan. What kind of service do we have now? What are we going to need? How can we enhance it to make sure that all seniors, so all municipalities are seniors friendly and age friendly and dementia friendly?
And thank you for that. And Gavin, you have a plan for how the questioning is going to happen, right?
Yeah, we just wanted to, I mean, I feel like, thanks very much, Dan. Thanks, Mary. It's, I guess it's one of these things where I live in this every single day, and it's, well, all I think about is just how we're going to help solve this challenge that we're faced with. But I do think that in the town of Qualicum Beach and across the province, it is that feeling of kind of being a little bit powerless sometimes, especially with a government that is in a position to, that is, well, I think at the provincial level, financially, we know there's been some money spent and there's a deficit that's growing, right? So it's hard, but I think our voice matters in terms of speaking up and making sure that we're heard. And I think that the seniors' voice is one that needs to be heard in particular. And I think also in Qualicum Beach, we've got many concerned groups. Big thanks to the Oceanside caregivers for being there. Like a lot of folks that want to make sure that not only their future is secured, but also the future of those that they love, most importantly, to take care of them. And so we really appreciate everybody coming out today. And so we want to just, to the extent that we can ask questions of Dan and Mary in terms of what they're seeing and what they think they might, how we might help, that would be great, because I think we do want to be active participants, and if there's anything we can do to support that here as well. So I'll go around and just give folks, or Sandy, maybe Sandy, or I'll walk around. It's okay. Yeah, I'll walk. I'll walk around the room, and we have a number of minutes here. And if there's any questions that we can't, if there are questions that we can't get to, which is probable, or you want more detail, please just come to us at the end of the session, and we'll make sure that we create the space or find a way to get those answers to you as well. So thanks very much, Sylvia.
My question is for you. I know that College Road got turned down. Do you have another place that you could build on, like behind the schoolhouse or at a place near the golf course? Do you have another place, or have you given up?
Yeah, that's a loaded question. I didn't expect that one. We're always, we feel, as Daniel has said, there's a need for more care. That hasn't changed, and so our role in that will hopefully we will have a role in that. We have to, I think, as a group, collect ourselves a little bit and make sure that we have something that makes sense for the town, and we will. Yeah, that's a question. We do feel we care deeply about this community, and so we are open to lots of different things, and so we'll be thinking about that and sort of watching things evolve over the next number of months. But we want to basically be here for the town in the right ways and the people of Polak Beach. So yeah, not a perfect answer, but that's all I have. Didn't expect it.
Thank you so much, Gavin. I think I speak for most of us here. We were absolutely devastated that the College Road was turned down. So in the meantime, I would ask you, first of all, thank you for sharing with us today. And we are aware of the terrible figures going forward. But today, as caregivers, we just had a meeting. I need to point out to you one of our most difficult areas is that our caregivers, many of them can be on the brink of burnout, just as you indicated in your slide. And we need help financially to be able to give them the respite that they need. This could be a 2 to 5 day period. several times during the year because they are saving the government billions of dollars. So what can we do? What can the government today, like what can be done? This is what we're dealing with every day here, personally.
So I just want to just echo what you said and what you said about the project being declined. Like that project should have been approved. The needs of seniors who need and caregivers should outweigh shadows or traffic or I appreciate those for those people with legitimate concerns, but we have to invest this immediately. We can't wait. So respite care we should have in Qualicum Beach. Overnight short-term respite care. We should have more adult day programs, and our office is looking very, very quickly on this issue because I think it's something that could be done very quickly. In terms, all you need is a space, and to lease a space. It could be commercial space. I've seen this in Langley where they've done this, and it's a low-cost service that could be created right away. So at the adult day programs and of course overnight care, we need more immediately. So I think your voices and your disappointment and your stories are so important to share. Share them with the local council and share them with your MLA. I would encourage you to do that. And certainly we will continue advocating.
Don't forget how politicians and elected officials respond to things, what influences them, right? And it's many, many voices. They know you vote. Right? So when it comes, because it will, right? It always seems like, oh, it's going to be forever till the next election. And then before you know it, it's upon you. Be challenging your individual candidates about issues like funding home care. Our organization, the BC Care Providers, has joined a partnership together with a number of different seniors organizations. We've only just had our first planning meeting, but we will very quickly ramp up and there will be a province-wide campaign to go along with what Dan and his office are advocating for, to advocate for the elimination of the copay. All of home support should be provided free of charge to the people who need it. And that should include respite care. I mean, I know exactly when my dad was 96 and was wandering and Fraser Health wouldn't pay for somebody to be there overnight. Sometimes I could afford to have someone while he was waiting to go to long-term care. Sometimes I slept over on his couch and put bells on the door so he couldn't get out without waking me up. But what did that mean, right? It meant that for days you end up at work, nodding off. I know I'm not alone. That's a minor story. I know people with way worse stories than that. So it's every day for people. But so you advocate and you do it, especially at election time, not only, but especially, and you have an MLA here, right? Everybody has an MLA. Make sure you're talking to them. You might think they don't listen, but I'm telling you, you get enough pressure in your local community. And this is, ordinarily kind of a swing riding, right? Could go either way. They know that. They start counting heads. They start knowing how many letters they got that said, hey, we want you to do this.
I would just like one of our caregivers to give you an example, if you would, what happened as to one bed available in one facility and two in another in a 50,000 population catchment.
Yes, in terms of respite care available, here in Qualicum Beach, I think there's only like 3 beds available for respite care.
This is an
Otherwise,
population.
yeah, that's for Parksville and Qualicum, the whole Oceanside area. So you have to go to Nanaimo to get access to more respite beds. So, this is.
Tell them how you felt about the 5-day period that you had, how stressed you were.
Well, yes, I was just recently, my husband has just been in respite care for a week. And before that point, I was on the verge of breakdown. And this isn't something that should have come as a surprise to our government leaders. We've known since I was a baby boomer in the 50s and 60s that this was going to be the giant generation and the influence it was going to have in the future. And you know, it was just chosen to be a report, so. I appreciate hearing, what some of your hopes and plans are, and really hope they get carried out more significantly.
When we look at where long-term care projects are being built, we know there's a big one being built in Lansville. We know there's a big one being built in Campbell River. But how far are those from here, and how would you get there? And why should you have to leave Qualicum Beach to go get care? You should have all the services you need here. If 3 beds is not enough for respite care for seniors, we should have the right number in where you live, so you don't have to leave town to get those services. They all should be located in Qualicum Beach.
So what can we do to get that?
Right.
Well, I'll tell you my creative advocacy. I don't think it's that creative. It's based on statistics. We need to impress upon government the problems that you hear about on the news, right? The woman that brings her 3-year-old in for a earache and there's a 13-hour wait in emergency. Well, all the issues that you're having with acute care, they primarily come back to our inability to deal with supporting people in community.
Yeah.
That's not just seniors, but a big part of that is seniors. Some of it's people with chronic conditions, diabetes, other things like that. But by and large, the pressure that is occurring on acute care and in emergency is because they're not looking after the community care end of things. And that means the safety net is right behind emergency, right? The reason the safety net's there is because after that, nothing but very bad things happen. We got to move that net back. So the advocacy has to be about, look, don't tell me you're building another hospital. Don't tell me you're expanding the emergency room. That's not actually the problem. It's where the problem shows up. That's not actually the problem. The problem is you are not doing enough to keep people out of the emergency and acute care who really shouldn't be there and aren't receiving the care they should receive there, right? They should be in a home, whether that's long-term care, their own home, what have you. They should be in a home, not a hospital.
And I'll just say, having some experience working with respite is that I think there's this assumption that it's just another person who's coming into your home as like a new resident, and that it's going to be really smooth and they're just going to stay for a few nights. I can tell you from experience that oftentimes those folks have dementia, and oftentimes they're quite unsafe because they haven't been in a care environment, and so then you period. And so perhaps they, haven't been managed as closely by a nurse, like we've been doing our best. The system is letting us down in many cases. And then they come into a place that they don't know. It's not home. And they're confused and they're lost. Sorry, I think this is very down. But okay, we're back. But it is let's just say it's a very labor intensive from that. I mean, a care intensive program. And with that, I'm saying it's very expensive to do it. And so I think advocacy for those kinds of beds is where it needs to start, because we're not talking about like 10% more expensive. We're talking about, you need a department that's dedicated to it with probably 50+%, maybe even 100% more staff to make sure that the needs of that individual are being met. Because with our residents that move into our homes, generally the first 2 weeks is sort of a feeling out period. It's very busy. We're saying yes a lot, we're adjusting, we're getting everything just right. Well, it's the same with the respite resident. So by day 5, when they might be ready to go home, is just when you're starting to get to a point where you're maybe meeting their needs. And so respite is a difficult thing to do. And so operators aren't lining up to do it necessarily. Because it's generally not being asked for because of that. Because in order to do it right, you have to charge. It just costs a lot of money to get it right. So I see that, and what I'm saying is, from an advocacy perspective, that's a voice. Sorry, is it working now? That's a voice that does need to be heard. So if you feel that need, I would definitely want to write to our MLA and council and whomever in the province.
The point being, many people, most people probably, I mean, Dan hears it on the radio. I hear it when I'm out talking to people. most people think that the way that you resolve the issues that you have in emergency and acute care is by putting more money into emergency and acute care, and that's not actually the way to solve it.
Most people want to remain in their home, Mary, don't they? So
Absolutely.
what we're talking about here is giving some help to the caregivers that are on the edge that need a few days.
There
Here and
is,
there.
so the point that, I'm sorry, I missed your first name.
Carol,
Carol, the point that Carol's making for those who can't hear is that most seniors want to stay in their home as long as they possibly can. Of course they do, because seniors are just like everybody else, right? You don't magically turn into a different species because you're a senior, right? You want to stay in your home as long as you can. The irony is that's actually better for government, right?
Oh,
It actually is better financially for government. It means the senior's going to be healthy longer, but it doesn't work if we simply close our eyes and say, well, the family will deal with it, right? Don't worry, the family will deal with it. What happens? Those numbers that Dan put up there, I will tell you right now, when you look into the demographics, he's got how many more seniors that are going to be, right? An awful lot of those seniors, more than now. An awful lot of those seniors didn't have kids, don't have families, right? I remember when my dad started wandering, and that was what triggered all this. We go through this thing, I'm staying over and all this stuff, and I happened to say to the fellow from Fraser Health, so what would happen if I wasn't here? Right? My mom passed away ages ago. What would happen if I lived in Ottawa or in another country or something? He's well, it'd be an emergency. And too many times that's the answer, right? And that's why I say what I do. So
we will be advocates, but in the meantime, we all will be advocates, won't we? But in the meantime, we need help right now. I had 3 people in our caregivers group a month ago that were on the edge. And what do? We try to get counseling so that the pressure is off right away. But I tell you, it's a heartbreaker. You know, we just need to know that there is some funding available to have those few days period to be able to get that rest to carry on for the rest of the time. Thank you.
no, I couldn't agree with you more.
Just have a question here at the back.
This isn't going to reach.
You're all set.
First of all, thank you to all the people who've spoken at the front here. I noticed that there's a paper going around for us to sign and our address and so on, and I assume that that's going to go on to the government. But my question is, wouldn't it be more effective if people wrote individual letters to the MLA? Because whenever I had an issue with the government and I'd written a letter, I got an answer, sometimes it's just a form, but then there's some action. When you send lists, yeah, that helps when it comes to voting. But if you really want to get action on this, I think you need to write even a 1-line letter about how you feel, how it's affecting you personally, and tell them that you need such and such. And sign your name and send it to your MLA and copies to other members of government.
100%. 100%. Do both, right? Do the petition, but she's absolutely right. There's nothing wrong with form letters. People have been sending form letters to politicians, low these many years, right? When I was a cabinet minister, I used to get tons of them. Ironically, you get more of them when some animal gets hurt than when a person gets hurt, but that's just the way it is, right? But no, do both. 100% though, she's right. If I'm sitting in my office and I'm a cabinet minister, I'm the minister of health, right? And I get 10,000 letters that are all the same letter, somebody just hit copy on their email or something like that. You notice it, but it's much more impactful if I'm reading it and it's from Jane Smith, who lives 2 blocks down from where my sister lives in, that person, that community, and that means somebody who votes.
Thank you. Just have a question here.
Got 2 questions, Mary. The question is, why aren't you still the health minister?
Well, there's a thing called,
Election.
Parliament and, confidence votes. And in 2017, we lost one. So there you go.
The second question is, could we reignite the public-private partnership programs that we used to have? So maybe develop some opportunities there?
There's some interesting things he's asking in terms of public-private partnerships. That's kind of the interest in that has waned, right? There are, though, some very interesting ways to go about building seniors' care that are tried around the province. One of the things we've been advocating for in our organization, and I think Gavin can probably speak to this in better detail than I can because he's been part of these processes, but is for government to have a continuous request for proposals program, right? So that they're constantly out there seeking the best contract to build a facility that they can with operators like Gavin and his team and others around the province. Because here's the other dirty little secret, that when government announces it's building a long-term care facility, the average cost for them per unit, it's taxpayers' money, is like 1.2, sometimes sadly $1.8 million per unit. For folks like Gavin and others, the average across Canada is about 600,000 per unit, right? Big difference. And that's taxpayers' money that goes into the mortgage. It makes it more costly for government to do it. So we need more of that. Public-private partnerships are an option. I don't think this particular government is all that interested in them.
Can I just add as well that there's a not-for-profit organizations as well?
Yeah,
Like
absolutely. I would include those in that. Yeah.
Like Aerosmith Lodge, which is a local one.
We have a number in Langley. My dad's in a not-for-profit home in Langley, and there's a wonderful place called Elam Village in Surrey. We have not-for-profits and we have private sector companies. They all provide that service. And the truth is, we need them all, right? We need them all. We need everybody as a part of this if we're going to make it happen. Government can't possibly do it by themselves. The number is too big.
A very quick, just to echo, in Penticton, it was announced this week that Kegel, which is a similar company to Care Group, they're building in Penticton 200 beds. So, and they're privately owned. And so there are operations right now that have been approved by this government that are privately owned by a for-profit company. I will make this note that and Mary's very used to this too. I always look at the political platforms of different parties. The Green Party, actually, the Provincial Green Party had in their platform to build 2,000 beds per year. Okay, so if you look at those numbers, remember I showed you 17,000 beds? If you look at the next 10 years, that would be 20,000 beds would be built. And so essentially, so if you think about this, to Mary's point, being very practical, we need to build approximately 2,000 beds every year in the province to hit that number. And to Mary's idea and Gavin's about this rolling RFP, each community should be able to go to government and say, here's a proposal. And if they hit the right numbers, check all the boxes, they should get built. And they can certainly stagger them. But we really need to see that investment going forward, whether it's owned and operated by the government like Lansville and Keller, or owned by a private company, or owned by a nonprofit. We have to see that infrastructure being built. We've got to start doing it now because it takes many years to get these projects to fruition.
Yeah, and I think that we need to ask government to take off any kind of ideological lens that they have that causes them to think somehow, oh, we shouldn't have not-for-profits, we shouldn't have private, we should only have, it needs to be everybody. They all contribute as long as they're adhering to the guidelines that are provided by government. As long as Dan says, they're checking all the requirements, then there shouldn't be any difference. There shouldn't be any difference.
As we have this discussion, please, everyone in the room should be aware of some of the past failures. And that includes ODET, Oceanside Dementia Education Task Team. That includes the Healthy Aging Initiative under the aegis of Dr. Lynn McFadgen, not here. And now we've also had the recent failure of rezoning for an additional healthcare facility here in Qualicum Beach. And somehow we've heard about private public partnerships, but Oceanside is the pointy top of the aging pyramid in Canada. It has the most inquiring seniors that are about, and it is the healthiest. And if we compare ourselves to our counterparts in the United States, almost twice the amount of money per capita is spent for those individuals. They don't live as their lifespan is 3 years shorter than our own. The models can and should be developed here. We're an autonomous community, but to find the answer is really very, very crucial. And but this is the place that it ideally can and should happen because of the population that makes up this particular community and area.
Thank you very much. So we're at an hour now, which was our target time. Did you get one last question, George? From George. George is the longstanding mayor of the Gardens of Qualicum Beach. What do you have for us today, George?
I just wonder how you overcome NIMBYs. Every time we turn around, you want to put something up, the NIMBYs come in and say, don't build in my backyard.
So there was a project in Washington, D.C. in 1969. They wanted to build seniors housing, affordable seniors housing in an upscale area of Washington, D.C. called Chevy Chase. And the president of the Geriatrics or Gerontology Association of America, a guy named Robert Butler, wrote an article about this NIMBYism. And the people who lived across the street or lived in the neighborhood didn't want the seniors housing project. And the way they were describing it wasn't traffic or shadows. It was the people who were living there. They said, we don't want that kind of person living there. And they were describing older people as they might people that would be subject to racism or to some other bigotry. And the bigotry was based on their age. And he coined the term ageism. So from my point of view, when you deny a project that is for seniors, that provides a valuable service that would address some very serious issues that you're all having, and that we're going to have more of going forward, I don't know what else to call it. I don't think it's about shadows. I don't think it's about the wrong height or the traffic. Those are serious concerns, but they can all be overcome. As I said earlier, the example in Richmond, which just got approved on Monday evening, not much different, actually much higher, and across the street from single family homes. That's like 7 stories. Why are we what's the real reason we're not doing this? And I think we have to push forward and listen to people, listen to the neighbors. We've got to get those projects going. And I really think the big piece is having an official community plan, an OCP, that mandates senior services, the respite care. I think we can look at the population up and down the coast. Basically, from where does population start? It starts in Cobble Hill. It goes probably right to Campbell River. The best retirement neighborhoods or communities probably in the country are in this area. And we should be ensuring the services are there. And you can look at the population. We know we need to build. We need a plan to build it.
So the NIMBY thing is tough, right? I started out, I spent 15 years in provincial government, but I spent 10 years in local government before that. I was a school trustee, but we had, our colleagues were on council. Tell you something that drives me crazy, and this is one of the things you're seeing here, is council members have forgotten that their appropriate role is not to go to a meeting and count heads. That's what the election was for, right? Their purpose at a public meeting is to listen, take into account what people say, and if somebody makes a good point, okay, you might incorporate that into your thinking. But you don't just say, well, gee, the majority of people here were opposed to something, therefore I've got to vote against it. That's not the way it works. In our country, you're elected to represent. That means you bring your own mind, you make the best decision for the public, and we need to bell the cat and remind council members when they're running that that's their job. Their job is not to count heads at a public meeting. Their job is to listen and make the best decision based on the information that they get. So the answer, it is that public battle. It's the numbers, it's the voters. There's more of you who want to vote for this kind of thing than there are people who are opposed to it. That's the nature of NIMBYism, right? and you gotta bell the cat. And, you know, it doesn't take a 3-page letter, right? It can take a 2-sentence letter. You can inundate the local papers if they still have them, with letters to the editor. But it's letting these local politicians know that when it comes to the next municipal election, the most powerful letter I used to receive as a politician was when somebody said, I am a voter and I intend to vote on X issue. Tell me what your position is. That's the most powerful letter you can send, and it takes 3 sentences.
Along the same line, particularly what I was told when I called council about why this project was turned down is that the traffic around that neighborhood was their biggest concern of the local residents. And I was also told that, pardon me.
Ruin their view.
Mhm. And the other thing was that the beds were not being funded. It was totally for profit, which is not the case I'm understanding. So that was part of it. So.
So we have one more question at the front here. I might give you the mic just so that it seems to be working now.
Yeah, okay. Oh, Lord, I'm stiff. And my name is Kim Slater. My aunt is Sylvia, is a resident here. And pardon me, I wanted to offer you a few perspectives from my point of view, because I had a mother who went through the whole continuum of care, ended up in long-term care in Nanaimo. And what happened at that time was contract flipping. You remember the history of that? Where the entire healthcare staff got fired 3 times and replaced with others in 4 years, with the loss of continuity of care. They didn't know staff members, despite their best intentions, didn't know my mom, they didn't know her interests, they didn't know her little idiosyncrasies and so on. And to make a longer story short, what I did was I started up something called a family council. Excuse me. And a family council is made up of people like me who want to have a voice in decisions that are being made in long-term care. And we did that, and it worked very, very well, to the point where eventually I got a call from the vice president of operations in the care home and said, look, what is it you want? And we said, we want you to stop contract flipping. And he said, okay, done. And after I cleaned out my ear to make sure that I heard him correctly, in fact, I had heard him correctly. And then we pushed further to have him stop it elsewhere on the island as well. And it worked so well that we decided that, you know, this community voice really matters. And you're the people who are walking the walk. We're the people who are experiencing, in that case, long-term care. But more than that, the whole continuum of care. But we've got to be able to do better than this. So what we did was we started up an island association of family councils, where we had councils represented from I think it was 13 different municipalities on the island. And suddenly the Ministry of Health was paying attention to us. Fast forward a bit later, I'll give you another example. During the pandemic, you recall when long-term care homes were basically shut down. They were isolated. Families and friends couldn't visit their residents anymore. And Minister Dix, and to be truthful, I thought he did a great job as a health minister, but he started a program called Equip Care. Equip Care was designed to fund care homes so that they became more sanitized, give them money to do that. So we sent him a note instantly saying, look, if you had contacted us, we would have pointed out to you that it's important that loved ones can get in and see their residents, not just for human kind of reasons, but because those loved ones have been providing extra care for residents that hadn't gone into the equation. They were helping to feed, they were helping to dress, they were helping to, and so on and so forth. And if they can't get in there, then the staff are going to be tremendously burdened by extra work that they suddenly have to do. To make another long story short, what's happened now is we've got a provincial association of family councils from all over the province. And suddenly we're sitting next to the Ministry of Health and providing input into decisions that are being made about the continuum of care and so on. So despite the best of intentions, writing letters and so on is probably not the most effective way that you can go. You have to become more involved that way. Does that make sense to you, what I'm trying to say? And it's now what we're doing is looking nationally and talking to similar organizations across the country to say, look, maybe it's about time that long-term care got moved under the Canada Health Act. And so we're beginning those kind of conversations, but it's tough slogging that's made a lot easier the more numbers you have sending those messages to politicians. So that's my 2 bits worth.
Let's get up to that. So it's having a strong family council is always a big part of ensuring that not only the families are heard, but the residents, and making sure that we've got good partnerships. So yeah, definitely appreciate that. It's been well, fantastic. I mean, in what you said, I think that active role is of the family council being so valuable. For the caregiver that's at home whose loved one is on a 2-year wait list, unfortunately, they're not in such a great position to be organized in the same way, because that's not structured. Luckily, we have the Oceanside caregivers here. And so we have to think about that and what it is and how that voice gets heard. And so we're here. I work on the board of BC Care Providers, working closely with Mary, and we work closely with Dan as well. If there's things that you would like brought forward, we need to hear those things. And so that is the sort of email is always open, the phone's always open, the door's open when I'm here. If you need help, please let us know and we'll pass on those messages for sure. So we're now at 12 minutes after. Dan, do you have time for one more question? Okay, one more question.
Respite beds in Qualicum. Yeah. We have respite beds at Trillium. We have one respite bed in Arrowsmith, and the next is down in the Nilo. So we have 0 in Qualicum Beach.
Just thank you for having the stats. And as I said earlier, what we really need to do, and certainly this is giving me, I'm going to be calling my office when I drive back to Victoria after this meeting, and asking them for, I want to look at the numbers right across. Basically, I don't know if I have the geographic area right. I was born in Victoria, but didn't grow up here. But basically from Cobble Hill to Campbell River, if you think about all that area, I want to know each community, what services are available and where the respite beds are. And we'll find out, thank you, we'll find out, for example, on respite as well, the other programs, including long-term care beds, how many respite beds we should have for each community. And then I'll be bringing that forward with the Minister of Health and Minister of Infrastructure.
I can tell you for a fact, last week I phoned up, my husband has Parkinson's and dementia, and I too have been close to breakdown. I've been 14 months on the wait list waiting for a bed for my husband. And I phoned up last week to ask about respite because I felt I was burning out. And I said, is there anywhere that I can get before, the end of December? She said, if you want to take him down to Duncan, which basically is way too far away, she said, we can probably get you a couple of nights there. But she said, booking in this area, she said, you're talking about the end of April, beginning of May next year. So for somebody who's birthing out and at the end of their rope, to have to wait till April, it's just crazy.
Thank you for sharing that. By the way, if you want to contact my office, we have an information referral line. You can call the number during the day. You can call tomorrow. Somebody will answer the phone.
What's it?
I don't have. I think it's. I'll give it to Gavin.
We'll get it for you,
We'll
Carol.
post it. I know it's 1-877-952 something. I think it's 3181.
Gavin will get it.
Yeah,
Gavin will
we'll
get
to you.
it. But please call our office. Share your story. And that can be part of our letter to the minister when we meet with her coming up.
We can get several letters, Steve.
Okay, thank you. I saw a hand behind the gentleman.
One more. This is the last one. Thanks for your time.
Sure, I've got a card.
Kevin,
I only have a simple question to the gentleman up front. How do we sign up?
Oh, for Kim.
I'm sorry. I apologize. What was the
So
question?
the question was, how do you sign up? Do you mean signing up for family council or?
Well, that was, what it is just family members who get together and they say, look, we want to celebrate the things that are really going well here. We want to support them. We want to encourage more recreation if that's what you're thinking. It's like you want to become part of the decision-making process. In terms of signing up, I personally have helped on the island, maybe 13 to 15 different family councils get started. So I'm very happy to do that here.
And we do have a family council.
Yeah.
Yeah.
But.
Yeah, so please just let us know.
Family council, you know.
Yeah.
Offer them some ideas, some connections and so on. So.
Yeah, please come and speak with Joseph or myself or Sandy as well. And we're happy to get everyone involved. Thanks very much. Well, I just want to say an extra special thank you again to Mary and Dan for coming out today. I think this has been a pretty productive conversation. I hope everybody learned a lot. And again, just want to say a big thank you. We have a couple little gift baskets